Ellen Simmons for the Rural Radio Network. November is Lung Cancer Awareness Month, and the Nebraska Cancer Coalition is working to increase awareness of the importance of lung cancer screening. We're joined today by Megan Schreiner, an oncology physician assistant with Nebraska Cancer Specialists in Grand Island and board member of the Nebraska Cancer Coalition. Now, in 2024, there will be an estimated 1,190 new lung cancers diagnosed and 700 lung cancer deaths in Nebraska. So, Megan, let's first talk about why is early detection of lung cancer so important?
Yes, thank you, Ellen. So by the time we diagnose most lung cancers, it is late stage, and the survival rate at 5 years is 3% or less. The sooner we can find it, like in an early stage disease, survival increases up to 63%. So if we can find it early, we can save lives.
All right. So what is the screening for lung cancer and when should it be done?
So lung cancer screening is a test similar to a CT scan. It's low dose, so the amount of radiation is very minimal. And it takes about 2 minutes. There's no needles or anything like that. And it should be done once a year. Individuals who have between the age of 50 and 80 who have smoked for at least a pack a day for 20 years, or if they have smoked a half a pack a day for 40 years, then they should have screening. If they have quit within the last 15 years, they still qualify. And it's something that you should always talk to your healthcare providers about. You should always talk about how we can be healthier, how we can prevent cancer, but also how we can find it early. And there are some risks, so that's a discussion that certainly needs to be had with the healthcare providers, but I think the benefits truly outweigh the risk.
Absolutely. Well, and that's kind of one of the things that I feel like has been with people who fear that they may be at risk for lung cancer. This is such a confusing thing when it comes to, do I qualify? Do you want to talk a little more about that?
Yeah, stigmata is such a huge thing. And some people do feel guilty for smoking, which indifferent, I mean, it's a life choice, but like you get mammograms for breast cancer. So why would you not get a lung cancer screening if you qualify, just to try and find lung cancer early? And there's tons of resources out there. So like I said, individuals aged 50 to 80 years old who have smoked within the last 15 years and that smoke on average like a pack a day or a half a pack a day for a certain amount of time. There's some math that goes into this, but those guidelines are loosening up. So even if you question whether or not you would potentially qualify, you should still talk to your healthcare providers.
Absolutely. All right. Well, thank you so much, Megan, for joining us. We really appreciate your time.
Awesome. Thank you, Ellen. Excuse me.
That's all right. All right. Well, for more information, you can go to nebraskacancer.org/lung cancer. And of course, November is Lung Cancer Awareness Month, and the Nebraska Cancer Coalition is working to increase awareness of the importance of lung cancer screening. So with that, I'm Ellen Simmons for the Rural Radio Network, and we were talking to Megan Schreiner, an oncology physician assistant with Nebraska Cancer Specialist in Grand Island and a board member of the Nebraska Cancer Coalition.